Bismillahirrahmanirrahim. I'm Dr. Shahid Sir, working as Professor of Medicine and Gastroenterology at Islamabad Medical College. I'm going to present today a study which we did in our center related to common white duct stones. As you all know, that CVD stones sometimes becomes a very difficult situation for the diagnosis. And obviously, before proceeding for ERCP, you would like to have a confirmed diagnosis of the presence of CVD. But unfortunately, this is one diagnosis which may be missed in imaging, especially in ultrasound, because of the location of the CVD, and sometimes advanced imaging procedures like MRCP may miss presence of the stone. So, and on the other hand, we all also experience the fact that you plan an ERCP for a CVD stone, but when you do an ERCP, there is no CVD stone as such. Now, obviously, ERCP is an interventional procedure with a lot of hazards and risks like pancreatitis and bleed and all those. So you would like some way of having as perfect diagnosis as possible before proceeding for ERCP. So different societies like American Society of Gastrointestinal Endoscopy, European Society of Gastrointestinal Endoscopy, they have proposed different scoring systems for predicting CVD stones. But none of them is accurate. None of them has got 100% results. So what we decided was to compare these different scores in their performance in predicting the presence of CVD stone or not. So the plan of the study was to include patients with suspected CVD stone, and there were parameters that we decided for suspecting this, just like a dilated CVD or presence of stone in that, or a patient with features of ascending cholangitis and biliary duct dilatation. We applied the scoring systems proposed by ASGE, American Society of Gastrointestinal Endoscopy, ESGE, European Society of Gastrointestinal Endoscopy, and Society of Surgeons of Gastrointestinal and Endoscopic Surgeons. These criteria are based on liver function test, on imaging results, and on presence or absence of ascending cholangitis. And then all of these patients underwent ERCP, where this was verified whether the stones were present or not. So total 90 patients were included, which went through this. And now, interestingly, what we found was that all these scoring systems, you are going to categorize patients into high risk, intermediate risk, and low risk according to these scores. So in high risk category, we found very good sensitivity and accuracy in predicting the presence of CVD stones, and it varies between 81 to 87%. But for patients in intermediate risk group or a low risk group, as per these scoring system, the sensitivity of these scoring system is not very good, except for American Society of Gastrointestinal Endoscopy scoring system, where low risk score is very good in predicting the absence of stone in CVD. So that's what we have come up with in this study. We feel that these scoring systems can be applied in high risk categories with good enough confidence, close to 85 to 90%, but those in intermediate or low risk category in these scoring systems will need additional imaging modalities like MRCP and EUS. Thank you very much.